Welcome to our presentation on Worksite Wellness Best Practices. My name is Julia Wilkins from the Health Management Department at Health New England, and we're going to learn how to make a worksite wellness plan and the ways that our health management team can help with planning, implementation, and evaluation. The following information we'll talk about is based on the Wellness Council of America's years of research across the country with industry experts, wellness professionals, and actual workplaces that have learned the process of creating wellness cultures, and some even earning awards for that. You're probably listening to this presentation because you believe and know that wellness and focusing on your employees' overall well-being is important to them as individuals, as well as beneficial to your organization. In order to get your organization on board, you need to ask, why is wellness for us? What is the crisis that needs to be addressed? What are the needs of our employees? What are the benefits to the program? And these answers will be specific to you and your organization. This chart here gives some examples of how workplace wellness benefits employees and employers. It's really easy to think about what benefits an organization, like productivity, lower amount of claims or injuries, recruitment, and the corporate image. Those are all really important for the success of an organization. But so are the people, the employees, who all have a life outside of work, so they have a lot of various factors contributing to their health and job satisfaction. An employee will believe that an employer cares about their health when they know the employer thinks about their self-esteem, coping techniques, their own personal health costs, and a safe environment. Of course, you want to know if wellness works at the workplace before putting in the effort. To answer this question, let's start with learning about where worksite wellness programs began to better understand how we can be effective in the future. So from the time workplace wellness programs began in the 70s, they were mostly based on lowering healthcare costs, prioritizing physical health. They had more of a narrow focus and were non-comprehensive, meaning they didn't cover all aspects of health or necessarily have a plan to conquer. It was seen more as an added benefit. And because at this time it was a new concept, we did start to yield results of lower costs over a long period of time. But a few years ago, the workplace wellness world started to hear skepticism about wellness programs actually improving employees' health and seeing meaningful business returns. Some large companies did studies to evaluate this, and the result was that, well, wellness programs don't make employees healthier or save employers money. But when you look at these studies closely, they show the short-term impact, and some of those wellness programs were actually developed just for the study. But nonetheless, they impacted how the media and employers viewed wellness, which is, while it's a nice benefit, don't expect much. So the Returns on Wellbeing Institute looked at organizations across the country in 2018 and conducted a 3-year study. And in that study, they found that a certain type of wellness doesn't work. It's the type I mentioned on the previous slide. And while people in the workforce and the world was changing, we weren't changing our wellness approach. So the Institute came up with 6 best practices that align with WellCoa's benchmarks, which is what we're going to discuss today. So those best practices from the study they found were having a strategic approach, that culture is a priority, approaching the whole person, needing leadership support, highlighting purpose as a priority, and that returns are measured. So as we move forward into the future, we need to remember to think about employees first, not just physically, but also mentally, their nutritional needs, emotionally, financially, etc. And we have to build wellness into the DNA of an organization and therefore are more likely to be able to see results in more areas than just our return on investment or ROI, but also positive and higher engagement, higher retention rates, better recruiting, and being more competitive, lower turnover, and company reputations. So in return of thinking about our employees, we build a stronger workforce and organization. 8 to 10 years ago, we at Health New England and many organizations in the area based their wellness approach on the Working for Wellness strategy from the Massachusetts Department of Public Health. And as we continue to evolve, I wanted to show you where we were and how it aligns with where we're going. In general, we still have the same goals, but we're digging a little deeper and making the whole person a priority. On the right are the 7 steps that we will discuss. Step number 1 is ensuring a committed and aligned leadership. This is the first step for a reason. Having leaders at all levels, not just our C-suite, committed to employees' well-being is vital for success. And employees immediately understand wellness is or isn't a priority by the example that is set. We could have our highest leaders supporting a wellness committee that's run by employees, but if managers and directors or that middle management isn't on board, it's not going to take off. So your job is to influence and drive buy-in and ultimately create the business partnership that's needed with decision makers. First thing you need to do is to listen to your leaders. Hear how wellness ties into their organization's mission and vision and what they think a partnership looks like. Then you need to influence your leaders. So you might be asking, how do I do that? It might be easier for some and more challenging for others. You may already know what makes your leaders tick, but speak to their head and their heart. Encourage them to potentially have their hands in the plan, embrace there might be disagreements, and stay curious to what they need. Create a need for wellness. Next, you then present your business case, including studies or proof that wellness works, a system of how you'll update them, as well as maybe coming to meetings quarterly and filling them in, and then also learning what their goals are, how you will measure success and outcomes, and what they will lose if wellness is not a priority. Once your leadership is on board, the second step is to collaborate in support of wellness. So this is where you set who in the organization will actually do the work to support you. Create a team that's dedicated to cooperating, building, and sustaining a successful worksite wellness initiative. So first, designate a wellness sponsor. You just talked to your leadership team. So this is someone that's on your C-suite. This person will be your liaison between you or the wellness committee and the upper management. It's also an added benefit if they can speak at company meetings or send emails encouraging wellness participation. They not only talk the talk, but also walk the walk. Then you need wellness champions. So according to Dr. Bennett, a wellness champion is anyone who fosters, facilitates, or engages workplaces and its employees in an active process of increased consciousness and wisdom, working toward a more successful existence. That sounds like a lot, but it helps if they have passion for wellness, because this is where the work is done on the employee level. Champions are important because they enhance the health, well-being, and productivity of the company's workers, families, and community. They have skills like working efficiently and successfully, commitment, planning, partnerships, communication, and knowing what's required of them. But they don't have to be a master. They just need to be trained or mentored along the way. This should include someone from all or most levels of your organization. They advocate for a healthy culture, make change happen, build awareness, and support others. Then you need a wellness committee. This could be made up of your champions, could include your sponsor or upper management. The structure is really whatever works for your organization. But you become a unit that learns with each other and supports each other. It should reflect the size of your organization, but we recommend about 5 to 9 people. And Health New England is always happy to be a part of your wellness committee. At the first wellness committee meeting, it shouldn't be a time to get together and talk about wellness initiatives and specific programs, but that first step is to create a vision, mission, and goals. So vision is your desired state, where you want to be, while your mission is your current state and how you want to reach your future goals. Then you look at your goals and objectives. These are SMART goals, meaning specific, measurable, achievable, realistic, and time-sensitive. During this meeting, also define the champion's roles, stick to an agenda, and take notes. Then set up the next meeting or remind of a recurring meeting. After these things are established, following meetings should discuss creating an operating plan and later the details of that. Step 3 is to collect meaningful data to evolve a wellness strategy. So determine the type of data you need to best understand your employees and the work culture you want to create. So before you start collecting all this data, think of these questions. What data matters most? What data ties into our mission and goals and vision? How often do we need to collect it? How will we keep this data safe? And where or how will we get it? Always consult with a legal team to ensure you're obtaining, storing, and using data properly. Collecting data also often helps buy-in and is linked to better returns and business outcomes. So start with any existing data like information from human resources, sick leave, workers' compensation or disability, and they might even have information on job satisfaction or any cultural analysis. Then you may want to look outside your organization, like information on social determinants of health or what other local businesses are doing in the wellness world. You can also then include information gathered by Health New England. We strongly recommend a needs and interest survey to see what your employees are most likely to participate in. We can also provide an environmental scan, focus groups, pre and post surveys, pulse surveys, participation rates, health assessment and biometric screening aggregate results, and claims or usage data. This could potentially be a lot of information at your hands, so don't feel like you need to conquer it all, but let it help you in the next step, which is creating an operating plan. So by now you should have a wellness committee and you just learned a lot about the people of your organization. Now's the time you and your committee need to outline and organize your wellness initiatives as part of your strategic plan. Plan programs that support your company's mission, wellness committee goals, and needs of your population and the culture you want to support. Then you'll know all your initiatives all year are pointing back to these things, making them meaningful and impactful. This is really the fun and creative part. This plan is unique to you, so you need to be respectful and open to all ideas. Start with the end in mind and move backwards. The goal is to make a difference in people's lives, so think less about simply participation and more about behavior change. You can use resources created internally, Health New England's turnkey programs in nourishment, movement, and balance, your EAP, community partnerships, benefits, really anything that helps build the program that meets your employees' needs. The key is to keep the plan simple, especially if you're just starting out. Maybe only have 1 to 2 goals. But for each goal or initiative, you do need to ask the questions of why, what, then how. Include your vision, mission, each goal, descriptions of those goals and initiatives, the dates you want to run programs, what the incentive is, who's responsible for what, your communication strategy, the set budget, and how you will evaluate. This can seem really overwhelming, so be open to this task taking maybe multiple meetings or one really long one. It could take some time. And then plan for upcoming sessions like doing this every year. Once this is created, be sure to share with your stakeholders for their continued support and feedback. Step 5 is choosing your initiatives that support the whole employee. This step you should keep in mind when creating your operating plan and as you're implementing programs. It's important that employees are motivated to improve their health and wellness so that they can succeed at what they want to achieve towards a thriving life. This step is all about showing employees that you care about their well-being. So like we discussed before, now we're looking at their goals not only physically, but also mentally, emotionally, their connections. Are they feeling safe? What are their benefits that they're being offered? Personal development and financial. Help people understand that they have a purpose and deserve connection. Also communicate your wellness program's purpose. You could link a community project to wellness, have a wellness day, collect success stories, something that gets people excited. But don't stop at thinking of them as an individual. Have programs available not only to their employee, but families, retirees, etc. Behavior change is just a buildup of habits, and habits take place in systems, spaces, socially, and in oneself. So support employees with your policies, environment, peer-based programs, and tapping into individuals' mindsets for motivation. Step 6 really ties it all together in creating a culture, which is the core of success, trust, and integration across all organizational functions and departments. It's important to support a wellness culture so there's consistency within work resources, interventions, and experiences. You want to encourage healthy habits and discourage unhealthy habits. This chart here shows a few examples on how to do that. As a whole, you want to ask, what do we say to our employees most frequently? What's our message, and is it supporting our wellness goals? Is it included in our onboarding? Can employees participate during work hours? Are we really showing that well-being matters? So think about a few things. Think about the environment, policies, and practices. These are things like workspace conditions, a tobacco or drug-free policy, access to healthy foods, access to private or quiet spaces, and Health New England has examples of some of these policies. Also, employee benefits. Are employees being paid a livable wage? Do they have disability protection or life insurance? Is there a leave policy, sick policy, flex time? Can I telecommute? Is there any options for child or elder care, flexible spending plans, retirement investment plans, or tuition assistance? Then make sure your organizational culture incorporates multiple touch points for wellness. This is in your communications, traditions the company has, trainings, and even recognition programs. Then create that supportive social atmosphere that has opportunities for connectivity, whether it's kicking off a wellness program with a walk around the block or holding a company-wide resilience and thriving training. Continue this work with sustainable and socially responsible business practices. Just like employees want to know if their life has purpose, they also want their work experience to have meaning. Get to know your employees, meet them where they are, and support the basic human needs of autonomy. After this step, you might realize that you already have a lot of well-being related policies or procedures or programs in place, and you want to connect with maybe HR, occupational health, office services, the on-site nurse, whoever it might be, so that you're all on the same page in the goal of keeping employees well and safe. Our last step is to evaluate, communicate, celebrate, and iterate. At this point, we already have a comprehensive evaluation strategy based on a guiding framework of alignment with leadership and operating plan. We just now need to do it. This is something we continuously do, making sure it's unbiased and still on track towards your wellness vision and goals. We'll also learn about what went right, what went wrong, and what we might want to do differently next time. The goal is to improve, not prove, your wellness program. Let the results be honest. In the past, you might not have evaluated for a few reasons. Maybe you confused evaluation with research, or you're afraid the weaknesses of your initiatives might be exposed. Maybe your initiatives were poorly organized in the past. You might feel like you didn't have enough time or money to do it. But when it's built into your operating plan, you are ready and prepared. Evaluation is essential because it allows you to obtain feedback that will improve your initiative efforts, demonstrate the value of your initiative, measure change, secure funding, and provide an opportunity to reflect, recharge, and reinvigorate programs or initiatives. So who should evaluate? Well, you'll collect data from various sources, but also Health New England can provide data from any programs that you run. Then as a wellness committee, you debrief and ask yourself some questions. What can you evaluate? There's a lot of things that can be evaluated. The planning process, participation rates, participation satisfaction, how people learned about the programs and the initiatives. Also, any changes. Changes in health behaviors and health practices, changes in biometric measures. Was there an increase in productivity? Were there changes in medical claims? Changes in the organizational culture or the environment? Was there progress? Progress towards the organization's vision of wellness, employees' performance and engagement? And how successful were employees at achieving their health goal, and what was that impact, like attitudes, behaviors, or skills? Make sure you always evaluate the outcome, asking yourself, was the goal met? And how do you do this? Well, it might look similar to step 3, where you're getting information from a lot of different areas. Those are some ways to evaluate in the stage 2, but now you're seeing if there's changes over time. So you're looking at step 3, and now you're looking at new data and seeing if there's any successes, struggles, or changes. When should you evaluate? You can do this at any time. You can have ongoing evaluation annually when you're looking at your program as a whole, or pre and post interventions. Again, with most of the other steps, always communicate your outcomes to your stakeholders in a simple way and then celebrate. This could be after your entire annual plan is completed or after one initiative you completed and learned from. Whatever it is, it's an accomplishment that you should be proud of. If you're interested in learning more about the tools that Health New England's Healthy Directions team can provide in your wellness programs or want to set up a call, please reach out via email at healthydirections@hne.com. We appreciate you taking this time to learn how to better create wellness initiatives that will work for your workplace. We hope these best practices will help you in the future.